Well, good evening, everybody. Contrary to what the sign says here, I'm not Barry Howard. I'm Tom Flaherty, the Webster Town Supervisor. It's great to see, last we counted, Barry, there's about 75 people in attendance, and I'm sure more will trickle in. Just a little recap of why we're here tonight is that in July of last year, the Nequals leadership approached the town board and requested an $800,000 tax district as early as January of 2023. The town board decided at that point to enter into a due diligence process so they could make an informed, fact-based decision on how much money, if any, in whether a tax district. 2 weeks ago, we had a town board workshop where we presented the to-date, at that point, results of that due diligence process, and also offered up some short-term and long-term EMS options for Webster. At that workshop, and I totally understood, people in attendance said, we want a chance from the public to speak. We want to speak, and totally understand that. And that's what tonight is about. So we're having this meeting tonight because we understand that everybody involved in this community discussion has good intentions on how to best provide a vital service without overburdening property owners and tenants who rent. This requires an open and honest fact-based discussion. I want to start by being sure that we first acknowledge and thank the professionals, the paramedics and the EMTs who answer the call. We acknowledge that you are not adequately compensated. This is true at the local level as well as across the state and nationally. How do we make a decision that is fact-based? We have been told by the leadership of Nequals that they need more funding. The specific amount that they request has varied from $480,000 annually to the $800,000 previously stated. We've not been told how the money will be used. Will it be used to increase the compensation for the underpaid paramedics and EMTs? What percentage will be used to upgrade outdated and failing equipment? The town board needs to see the most recent audited financial statements. We need to see a business plan. We need transparency to make that fact-based decision. The town board will make this decision based on governance. It is our responsibility to provide a critical, often life-saving service to our town residents. It's our fiduciary responsibility as your elected town board to provide this service in a way that allows growing families, as well as grandma and grandpa, to remain in their homes and not be financially overwhelmed with increasing taxes. Now I'm about to hand the microphone off to Barry Howard, who is going to be the moderator tonight and will explain how this format will work. But first I want to introduce the panel of five who has graciously accepted to come in and answer the questions from the public. Starting on the far to the audience right is Paul Adams. He is the Town of Webster Finance Director, and he was the point person between Nequals and any third party that services Nequals within the due diligence process the last 9 months. Next to him is Tim Sopransky, who is the Monroe County EMS Administrator. Just to give you an idea of what that means, Tim coordinates the mutual aid for all the EMS agencies in Monroe County and also oversees training for the EMS. As we move along, Ahmed Mustafa is the CEO, Chairman of the Board of Nequals. Next to him is, I would say, his exact mimicked person. That's Russ Ziskin, who's a Webster resident for 10 years, and also is the Chairman of the Board, CEO of North Onondaga Volunteer Ambulance that services the 60,000 population of Clay, New York, near Syracuse. And then finally, we have John Cahill, who is a town councilman here in Webster, but he's also the town board liaison to EMS. So with that being said, I'm done on the microphone for the night, and I'm going to hand it off to Barry Howard.
Good evening, everybody. Is my mic working? Perfect. Look at that. That's what we needed. So I want to just go over a couple of things and give you some guidelines, give you some help with how we want to move through the evening. But before we do that, to tag on to Tom's comment about the fact that there's a level of gratitude for the EMS people that are in the room. We're grateful for your service, and I was informed this evening when I got here that one of our local paramedics, a longtime paramedic, Matt Ray, died unexpectedly this weekend, and there are several EMS personnel in the room, so I'd just like to take a moment to remember that one of your fellow EMTs has passed. Thank you. So up on the screen this evening, you're going to see a couple of things. One is that we got a little bit of guidelines for tonight, not a lot, but just enough that we can try and keep things under control. So the first one is that we'd like you to be polite. We'd like you to be civil. Please be considerate and respectful of others. This is a fact-finding question and answer forum. So there shouldn't be any yelling or cheering or booing. Most everyone in this room looks like they're an adult to me, so the expectation is that you will all act accordingly. That means that there should be no name calling, no attacks, and no interrupting others, please. We want everybody to be heard, and we want to hear everybody's questions and the answers to those questions. So in round one, we're going to have you ask one question. We'll have you step up to the microphone in order the way that you signed in. We'll ask you to ask your question. We received approximately 50 questions via the website portal, and we have several people here tonight to sign up to ask a question. So we'll work our way through each person and limit them to one question. If everyone has asked their one question and we have time, we will invite people to return to the podium with a second question. This allows everybody to be heard and prevents the questions from being dominated from one perspective. It also makes it possible for us to limit this meeting to 2 hours. Our expectation is that we'll finish up at 9 o'clock. We're in somebody else's house, and we made a commitment to the school district that we would be out of here by 9 o'clock. It's also possible that your multiple questions will be answered as we move through the process. We found that the 50 questions that were put in at the portal, that we were able to cull that down to really about 20 questions, because people asked the same question multiple times or in kind of different ways, but it was basically the same question. So as we move through that process, if that happens and your question's been answered, feel free to say, I'll pass. If I call your name to come up to the microphone and your question's been answered, feel free to say, no, let's go on to the next person. That'll help us move through our timing. And then the last is that this is an information forum. Just a reminder that no decision is being made tonight. The town board is on a fact-finding mission, and tonight is part of the process that has been ongoing for quite a while. The focus tonight is to answer questions that the audience and the citizens bring to the microphone and brought through the website portal. And it's likely that some of the questions that are going to be asked tonight, either due to the lack of data available tonight from a panelist or because the answer involves a decision that's yet to be made, it's possible that that question can't be answered tonight. So it's important for you to understand that every effort will be made to answer it when it can, and all of the questions and the panelists' answers will be available on the town's website as soon as they can be transcribed. This is being recorded. Because of the venue, it's not being live streamed, but it will be put onto the website as soon as Karen can get it up, hopefully in the next 48 hours. It'll be up tonight, so that's fantastic. How about that? That's pretty good. Okay, so let's get started. I'm going to do a number of these questions from the portal first, and then I'm going to probably call some of you up, and then maybe we'll go back to some of the portal questions. So the last part that I want to tell you is that we have a little timer that's here. It's like a little stoplight. It's got green, got yellow, and got red. We're going to ask that your comments be limited to 2 minutes. 2 minutes is important because when you have 80 people in the room and 50 questions down to 20 questions from the portal, we could be here till next Tuesday trying to get everybody's minutes in. So we're going to limit you to 2 minutes, so please kind of be prepared. Ask your question. We want to know what your question is. We want to have the panelists have time to answer it. So that little green light will come on when you start to speak at the microphone. The microphone is pretty easy. If you have a height issue, up or down, if you're extra tall, you can just squeeze this and the mic will go up. You can squeeze it and the mic will go down. When you ask your question, the timer will start with 2 minutes. At 1 minute and 30 seconds, the yellow light will come on, and at 2 minutes, the red light will come on. We ask that you respectfully finish up when the yellow light comes on so that we can move on to the next questioner. Are there any questions? Good. Okay, so let's get started. NEQ proposed additional taxpayer funding with no changes to organizational structure or leadership. Since the town owns the con, can the town require changes to the agency's operation even if the NEQOLS board is not in agreement? Can they require metrics and oversight, including consequences for noncompliance? I think I'll field that one first to John Cahill, and then maybe we'll have Ahmed chime in.
Well, we currently have a contract with NEQOLS through, I think it's 2025, so
Is your microphone on? There you go. Bring it a little closer.
how's that?
That's better.
Sorry about that. We currently have a contract with NEQOLS for service, I believe, through 2025. And part of the due diligence and decision-making process that the board will be making will address those issues. And when we get through the due diligence, and part of the due diligence is the questions tonight, then we will enter into discussions.
Ahmed, you want to comment? No, thank you. Okay. So you kind of took me right to, you answered the second question right off the bat, that in the 2020, or in the 525 presentation, page 8 says that the most recent contract was for 1 year, but on page 9 it says the contract with NEQ to provide BLS services covers the period of 2021 to 2025. So can you clarify which is correct, which I think you just did?
Right.
It's a 4-year contract from 2021 to 2025, correct?
Correct.
Pardon? 5-year contract,
5-year
excuse me.
contract.
Yep, excuse me, yep. So next up is what has happened to the overall call volume since the days of Union Hill and the West Webster Fire Department covering calls in Webster? The 525 presentation indicates that WEMS, compared to surrounding similar agencies, has the highest mutual aid into Webster, where an outside agency provides the call response because WEMS can't. Why is that? And does NEQ have a clear plan to reduce the need for outside mutual aid coverage into Webster? I'll go with Ahmed to start.
Sure. So if I remember that chart, and let me see if I can reference it really quickly, that was not mutual aid given into Webster. Let me see if I can get it. That was mutual aid out. And the reason that Webster gives much less mutual aid out is it's a decision we made. There is something that we've called reserve capacity. Many EMS agencies in Monroe County chose to do this, some did not. The idea was we wanted to always make sure there was an ambulance in town. As many of you heard during the COVID period, the city was a tremendous black hole for EMS calls. They were short-staffed, call volume was up, and those agencies most close to the city, Irondequoit, Brighton, Penfield, Pittsford, were doing a lot of mutual aid calls. Over time, some of them said, we have responsibilities to our town, and so we developed a thing called a matrix, which basically said when there are limited resources, we are going to refuse mutual aid. Webster, we have adhered to that very strenuously to make sure that we had resources in town. Other agencies didn't, and that's why you see the disparity. That chart was not reflecting calls into Webster, that was reflecting the amount of mutual aid out that they accepted elsewhere. We chose to not give a lot of mutual aid out of Webster. It's on the chart. Yeah, but the top says mutual aid out. The 1,000 calls is mutual aid out. The mutual aid out we gave was 148. We chose not to give mutual aid out. Yep.
So what's the cause of the 275 coming in to cover calls in Webster?
We tend to get calls in what we call waves. We get them 2, 3, 4 at a time. We staff 2, sometimes 3 ambulances depending on the day. You will never cover 100% of your calls, and so we took mutual aid in. Also, in the 4th quarter of last year, we had a terrible time with staffing. Our crews were burned out, and we had very low numbers, and so we, again, chose to make sure that whatever we had, we kept in town.
So the second part of that is there a plan to try and reduce, what efforts are you making now to reduce outside mutual aid coverage into Webster?
Yep, so when we look at Q1, which the town has seen the numbers for Q1 and through May of this year, our call coverage has gone from as low as the low 70% in December, because we had a tough December. We are now running in the mid to upper 90s consistently. It's a matter of staffing. If there are not people, we cannot staff ambulances. And the people are just not there. We have had a very long 2 years, and we just don't have the numbers like some other agencies, so we did the best we could.
So we'll get to the questions as we go before we get to comments from the crowd. If we could do that, I'd appreciate it. So next question up is that we received several questions regarding paid staff versus volunteers. It's a little bit of a misnomer sometimes when an agency is called a volunteer ambulance. Models that use paid and volunteer staff, such as multiple fire departments use. How is NEQ WEMS staffing their operations, and how do other agencies staff regarding paid and volunteers? So Ahmed, I'll start with you. Where are we with NEQ and WEMS?
So WEMS has always been a fully paid ambulance service. We didn't have the benefit of starting with volunteers. We always have paid all of our staff, and that is the model we continue to use.
Russ, you want to field that one to see, what about your agency? Are you all volunteer, or all paid, or both?
So our agency started off all volunteer when we founded it back in 1994, and we are down to literally 0 ALS providers that volunteer, which is very common throughout the state, and we have very few basic EMTs that volunteer. So volunteerism is just significantly down everywhere.
Okay. According to the 525 presentation, similar EMS agencies with higher call volume have received fewer tax dollars over the past 6 years than NEQ has received. Why is there a discrepancy in call volume and tax dollars between the 525 presentation and the NEQ presentation in 2022? And how is it that these agencies have well-maintained ambulances on the road, staffed with experienced ALS crews, yet Webster strives to get there? Ahmed?
Yep, just looking for the chart. So as Russ said, many agencies in Monroe County, in fact, almost all of them, started with volunteers and started billing in advance. They were able to save money and build what I call war chests up. WEMS started paying staff from the beginning, and we did not have the opportunity to raise, a war chest like that. So we have been trying to balance our budget and continue to operate as we have gone forward, and we've done a good job for the last 6 years.
I think a lot of the profitability depends on the mix too, the volume of calls and the types of those calls.
Yeah.
If you're doing Medicare and Medicaid, that's a much lower payment into an equals.
And I think I could add a little to that, which is one of the things that I think folks need to understand is there's this thing called payer mix, right? You have commercial payers like Blue Cross Blue Shield, and you have Medicare and Medicaid. For instance, at our agency, we have about 75% of our the people we transport are Medicare, Medicaid patients, and only 17% are commercial payers. Even though it's only 17% commercial payers, they represent more than 50% of our net income. And so the payer mix is a very fragile thing, and that is town to town. You can't look at one agency and say, like Nova, where we do 6,768 calls last year, and look at another town that does the exact same number and say, oh, you should be about the same. If we went from our 17% payer mix to 15%, if we lost 2% of that commercial payer mix, we would be going to our town asking for money. So it's a very fragile thing. And I'll give you an example of cost. If you were to say the cost of an ambulance, the cost of running an ambulance call is, say, somewhere between $500 and $700, depending on your call volume and economies of scale. I just talked to my billing company just before this meeting to make sure I had this number right. The average Medicaid reimbursement we get is $236. Where's the rest of the money coming from? Again, the commercial side. So payer mix is hugely important. And that is something that we need to evaluate in our community in order to have a proper way of managing the money side of this. It doesn't matter whether it's NEQUALS or anybody else. Our payer mix won't change, right? The people that live in our community will not change depending on who's coming here. So pretty important as part of this process to look into that.
Well, you two segued right into the next question, which is that we know that Medicaid and Medicare reimbursements, as Paul indicated, have an impact on revenue. Do either of you, Russ or Ahmed, want to talk about what efforts are being done now to lobby politicians for increases in Medicaid and Medicare reimbursement for ambulance services?
Sure. So, as some of you may or may not know, I sit on a New York State Senate Rural EMS Task Force. We have had lobbying days recently in Albany. The challenge is that while we consider EMS's payer mix and the Medicare and Medicaid issues to be significant, we have met with Congressman Morelli, we have met with our local state officials. The challenge is we are a small percentage of a very large problem in healthcare. The nursing homes, the hospitals, they're losing millions of dollars a day. So while we worry about losing a few $100s on a few thousand calls, in aggregate, that percentage is far smaller. They are focused on keeping hospitals and nursing homes alive. We hope at some point that EMS will get swept into some of those discussions. But right now, there is such an underfunding for Medicare and Medicaid at both the state and federal levels. They've got to make sure that people that need hospitals and places to live are funded. And right now, that is not, that is priority number one. And we've been told that for years.
Yeah, and on top of that, there's some laws that are specific to New York State that are certainly problematic. For instance, ambulances can't balance bills. So that means that if you get a bill and your insurance company pays a piece of it, and we can't bill you the rest. The other thing that says is we are not allowed to do anything to affect your credit, so we don't have a way to even ask you for that money, right? And the state and the government gets to determine how much we're supposed to charge. We don't get to say, here's what, our business costs are and what it costs to provide this service. So they say, we're gonna give you $236 for Medicaid. They get to determine what's called unusual and customary fees. There's legislation pending as of right now, as introduced in April, that talks about excluding ambulances as part of a greater exclusion for healthcare when it comes to this thing called balanced billing. But it doesn't take into account, folks, now listen to this, it doesn't take this into account. Let's say we bill you $800, and the insurance company pays 80% for you. So you get a check for $640 in your name, and you deposit it in your bank account, and you go spend that on a stereo. There's no way for us to ask you for that money. We can't collect it. You keep it, and we don't get it. We had like almost $7 million in write-offs last year because of money we're not allowed to collect because of regulations and laws. And that, again, is not going to change no matter who answers the calls. Hear it.
Thanks, Russ. So the next question up is that Webster is the only town in Monroe County that owns their own con. And that's a certificate of need. I'm pretty sure most everybody in this room knows what that is, but most other agencies use a model staffing their ambulances with an ALS paramedic, but NEQ uses BLS ambulances with a separate ALS paramedic fly car model. If NEQ has financial difficulties using this model and other agencies are seemingly financially stable, why doesn't NEQ use the more successful model? And does the county have any requirements regarding the model that an agency uses? So we'll start with Ahmed, and then maybe I'll have Tim chime in.
So I don't think we should confuse the response model with the financial situation. Last year in Monroe County, we heard during EMS Week, Monroe County graduated 20 paramedics in the entire year. 20 paramedics. That is to cover 18 EMS agencies throughout the county and all the towns that we have. There is a shortage of paramedics, and a majority of the calls that we take are basic life support calls. They do not warrant a paramedic. And so we have very successfully for many years operated a model that we send the paramedic in some cases separately. If they are not needed, they can return to service, which will either allow them to respond with another ambulance or in some cases first respond until a mutual aid ambulance can come. Right? Many days we do run the paramedic on the ambulance, but we leave ourselves the option so that, like yesterday when we had multiple calls that are dispatched, the priorities determined by the 911 center, not by us, but are dispatched to ALS, and we get there and there's no need for it, that paramedic can free up and be used somewhere else.
Tim?
Follow up, the county doesn't have any requirements or regulations regarding staffing or whether to use a tiered response into a system with BLS ambulance or ALS fly car. What we do have is a REMAC, Regional Medical Advisory Council, which there are 18 regions in the state. Our REMAC is Monroe and Livingston County. So a CON holder can make an application to REMAC to become an ALS provider, and so they're the ones that look at regulating the advanced life support portion in our community.
Do you have any indication or any thought on how many agencies work with which model in the county?
So of the 17 transport agencies, the majority of them put ALS on the ambulances. So Pittsford Ambulance acquired SEQ years ago, and they pretty much retired that model. I think it works for them. Each jurisdiction is a little bit different. I like to say EMS is local because it is different throughout the county.
Okay. Next up, NEQ has recently been cited for violations by the state. Are there regular inspections of equipment and supplies, mandatory training, and documentation to show that the violations have been resolved, including actions to taken to prevent future violations? And are there written reports supplied to the town when this happens? I'll go with Ahmed.
You sure so no one else wants this one? So yes, we did have a bad week a couple of weeks ago, right? There's no denying it. It was a fact. Our crews had come off a cardiac arrest call. The ambulances were not properly secured. The ambulances were not properly gone through before the shift. And we came back. You know, there's two things you can do. You can sit and say, oh, you know, we didn't do the right thing and complain about it and point fingers. Instead, we rallied. We got 2 of our backup ambulances in service within a few hours, and patient care continued. So, you know, we have worked with our operations staff, our new operations chief Lloyd, our lieutenant, and our crews to remind them that ambulances should be locked at all times, that equipment should be checked. You know, some of the things that were cited were alcohol swabs that were expired. I'm not sure that's going to impact patient care. There was a sharps that was left out. That impacts patient safety, right? So we have revisited our policies and procedures. We've become more rigorous in our rig checks. And it's important to note, NEQ was not the only agency that was cited that day. There was 2 other agencies that were also cited. You know, for many years, and I hate to say this, you know, during COVID, things got a little bit lax, right? Now the Department of Health is coming back and checking, and they're going to get us back up to the level we should be. So we learned from it. We won't do it again.
Ahmed, are there written reports supplied to the town when something like that happens?
Yep, so the county sent a report to us and the town supervisor the day that we were notified. Apparently they didn't have the right email for the supervisor. And then we subsequently sent a corrective action plan. So with the exception of the physical maintenance of the ambulances, which are waiting for shop time, all the other issues have been fixed.
Based
Okay.
on the liability that comes with the CON, the town may actually consider requiring some reporting requirements as part of future metrics. That's something we're thinking about.
Thanks, Paul. In the 525 presentation, it indicated that NEQ has staffing contracts with other towns. Do these contracts reduce the ability of WEMS to answer calls in Webster, and why should Webster taxpayer money be used to staff ambulances in other towns?
So let's be very, very clear, because this has become a very confusing point. The staffing contracts in no way impact WEM's operation. Those are employees that are hired for those locations. Many of them live geographically close to those locations, and those contracts generate a profit, not a loss. So if anything, they're helping WEM stay and NEQ stay operational, as opposed to, you know, losing that revenue and that profit. But just to be very clear again, those personnel don't work at headquarters. They stay at their locations. They live geographically close. And the last one that we have is in Livingston County at the moment.
Russ, do you have staffing contracts for your people to go out into other ambulance corps?
No, but it is very common in our county to do that.
Okay.
I think there were actually 2 active contracts in 2022 and only 1 in 2023. I think in 22, about a third of the man hours were devoted to that, but as Ahmed said, you're not thinking that it had any impact.
No,
on
and
the
we track
service within the town.
we track the income and expenses for them as line items in our budget, which the town has had full access to, and they were in no way costing us money to operate those. We were making a small profit on each.
Thank you. Can the town decide to fund a specific purchase such as equipment or an ambulance rather than just providing a lump sum? I guess, let's start with Councilman Cahill.
Well, I know that the town can utilize that option, and I believe that Arundecoit recently did that, purchased an ambulance for a new ambulance for the ambulance provider in Arundecoit, so the answer is yes.
Okay.
And Mr. Howard, I would also like to say that, you know, last year the town gave us $204,000 of federal money, the ARPA money that they were responsible for dispersing to the community. And as we committed, all of that money was used 100% for payroll. We told them what we were going to use it for, we have tracked it, and that is all it has been used for. and they have seen the books to show that.
Okay. So other agencies such as Gates, Arundecoy, Brighton, Henrietta, and Penfield have received grants, some for new equipment, including recent grants from Monroe County. And why have they received grants and NEQ has not? Does NEQ WEMS apply for grants, and have they received any grants, and do they have any fundraising programs similar to other agencies like the fire departments?
Yep. So we did apply for grants. We've applied for grants to Congressman Morelli's office, to Senator Brooks' office, and to Monroe County. And here's what I will tell you that I've been told twice now, that the confusion and concerns of what's going on in Webster has dissuaded them from giving us any money because they're not sure what the outcome of our organization will be. So we were qualified for grants, we were on the grant list, and 2 of the 3 people have said, we did not give you grants because we were not sure what your future was going to be. So all of the confusion and discussions that we're having are now having a negative impact on our ability to secure grants. The county has $10 million, I think, they allocated for fire and EMS from the ARPA money.
So no, EMS, I think the total grant were, I think, 5.4 million
5.4 million.
for EMS.
Ambulances were awarded, some for as much as $360,000. Our application was reviewed, and I was told very directly that is why we did not get money.
So next question is that NEQ WEMS has asked for additional funding from the town in the form of immediate funding and long-term funding using a taxing district. The town of Webster has provided $605,000 to NEQ over the last 6 years. So how can they say that the town doesn't support them? Why is additional funding needed when NEQ has received more public funding than other similar agencies in our area and has seen an increase in revenue from taking over the West Webster calls? Has NEQ provided details for how they used the funds that were already provided, including the $205,000 in ARPA funds? And do they supply a line item budget of their income and spending cash flow projection of how they will spend the money for any additional funding received from the taxpayers?
Yep. So we do provide line item data. The town has had full access to our books all the way through the end of 2022. So earlier it was said, I heard somewhere, that the town has not seen our books or anything. Mr. Adams is sitting right here, our office manager is sitting here, our accountant sat for days and had full access to all of our QuickBooks files through the end of December 2022. We do provide accountability for the $204,000 that the town awarded us. That was, as I said, used 100% for payroll because that was our first priority and remains our first priority, and is about 74% of our expense, of our operating expense.
As part of the ARPA grant agreement, the town does have the right to audit. We have not done so at this point. I think there's an assumption that most of the money was needed for staffing, some equipment and supplies, but we have not asked for specifics. And we have not seen a detailed budget. And I'm not sure that we really asked for a budget. But, so at that point.
So the data you have covers what period, Paul?
The data I reviewed went through November, the end of November 2022. But the ARPA funds could be spent over a multi-year period. But.
Okay. All right, I've gone through a bunch of these. I'm going to hold off on any more off the portal and let you people have a chance to come up and ask some questions. Again, we'll remind you to come up. You're going to be timed for 2 minutes. If you could please ask your question, and then we'll have you ask your question and then take your seat, and then the panelists will answer your question. So the first person that signed up on this list is Jim Redmond. Is Jim still here? You want to step up to the microphone, please?
First off, thank you for the opportunity to speak tonight. I've reviewed both presentations, and neither presentation that are on the town website show any actual financials. You know, basically, Nequals is asking the taxpayer to subsidize what is essentially a private company, a 501c3, but still a private company. And I don't see any evidence of financial need, and I don't see any evidence of a business plan for how any tax dollars will be spent. And since the town has set a deadline of June 30th for coming up with a short-term solution and hopes to get to a longer-term solution later on, my question is, when will the taxpayers be able to see audited financial figures for 2022? And when will we see a business plan for where and how and just what this money will be used for?
Thank you.
Thank you.
You want to go first, Ahmed, and then maybe we'll have Paul chime in?
Yeah. No, thank you, Mr. Redding. So, just to be clear, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 EMS agencies that cover Monroe County are 501c3s. Of those, they get 3.7, almost $4 million in tax money. This is not an unusual model. The county operates with private entities. That is how EMS is provided in Monroe County for the majority of the time. Our 990s are available publicly. We provide them to the town every year. You can get them on a website called guidestar.net. Guidestar.org. You can look us up. They're out there. They're out there. Our audited financials have not been made public. We are a private business, and putting some of that information out in the public will give some of our competing agencies a competitive advantage on how we run our operations. That is why the information that we have shared with the town has been done in a way that only the town can see it, because we are competing interests in some ways, and it's not in our best interest to share that in a way that our competitors can see that. I'm sure you understand that.
Paul?
As part of the due diligence process, I did a statement of cash flow for 2022 and projected it for 2023. And based on the expenditures, projected net income or loss, and need for cash, I had them burning between $15,000 and $20,000 per month in 2023. And from what I've heard thus far, that seems to be on track. Things are getting tighter and tighter. They finished the year with some cash in the bank, leftover ARPA money, but they're burning through that quickly and dipping into their credit line.
And Mr. Redding, one other thing that we'd like to say, just coming back to the ambulance disaster we had a few weeks ago, we cannot in good faith go to a bank and ask for a loan to take out and buy an ambulance that costs $250,000 if I'm not sure I can pay my people and keep the lights on in the building. I'm not going to do that. My board won't do that, right? That's irresponsible. And so that is why we're asking for help. There's something called the cost of readiness. Russ can fill in the gaps if I don't say it correctly. But EMS only gets paid when we transport a patient. So right now, I've got my staff sitting here. We're not on a call. We are not generating any revenue. However, we are generating expense. And so the help that we need is filling in this cost of readiness to help us pay for some of the downtime when we are not generating revenue. As Russ shared earlier, some of the revenue we generate is at a loss, right? It doesn't cover the cost of our calls. Additionally, we would like to be in a situation where we could save some money. Last year, we were up for a grant with Senator Gillibrand, where I was terrified that we would win it. We asked for 6 new ambulances to the tune of $1.2 million. The problem is it was a 75% grant, which means we would have to have come up with $300,000, which I didn't have. So actually we would have won that grant and not been able to accept it. So this is the kind of things we're trying to work. It's not a complicated business plan. 74% of our expense is people. We have lights, electricity, utilities, and then we try and save some. And at the end of the month, we can't save any. We don't get the equipment and supplies we'd like to upgrade.
Paul, what's the last year that you have a 990 for?
Last 990s for 2021. That is typical. It takes a few months to wrap up the audited financial statement, then the 990 follows. So I think they're close for 2022.
Yep, our auditors sent us a letter the other day saying that we expect to have our audit hopefully done by the end of June. Please realize this is something beyond our control. Sue, our office manager, sits with them, gives them all the data they need, then it's up to them to go do all the work that they do to generate an audit. It is not something we have any influence on the timing or the results of. So when it's done, it will be done, and we will share it with the town as we have in the past. And as Paul said, I'm not the financial expert in the room, Supervisor Flaherty and Paul are, but we understand that they like to finish the audit first and then complete the 990 so that the numbers are aligned. I think that's a correct statement.
That's correct. I think you're better off reviewing the audit report anyway. It has footnotes and it explains into more detail than a 990 would.
Okay. Next speaker that asks to ask a question is Richard Jones. You step. Sorry? Going to pass. Next up is Ron Nesbitt. Would you like to pass, Ron, or are you going to come up?
question is, why should Webster taxpayers give Nichols Weems 1 red penny more when the CEO signed a 5-year legal binding contract in November 2020 that doesn't include them getting any money from the Webster community? On top of that, the CEO signed a confidentiality agreement in 2021 or 2 that doesn't allow for the Webster taxpayers to look at any financial statements, and the CEO continues to stonewall the Webster Town Board to obtain these documents. And I continue to file FOIL after FOIL after FOIL, and I get denied as a taxpayer of this town. So why should I want to give Nichols any more of my taxpayer dollars if I can't look at the financials? Thank you.
Thank you, Ron. You want to start with Paul, or you want to go with Ahmed to start?
Probably Ahmed.
Okay, Ahmed.
Yeah, I'm not going to answer the FOIL question. You're not foiling me. I don't know the FOIL rules. I'm not a foilable organization, so that is something you're going to have to ask the town attorney. I'm not familiar enough with that. As far as the contract, Ron, you were right. You and I started this ambulance service, right? Let's just say it very openly and publicly. We walked hand in hand, and we started WEMS, right? Why you have taken such a turn is completely beyond me, but the reality is the situation has changed. The economics of providing EMS in the last 3 years have changed dramatically, right? And so if you cannot acknowledge that times change, then I'm sorry, I can't help you. But the reality is all of our costs have gone up, our reimbursements have gone down. As Russ said, we cannot chase patients for collections for a minimum of a year, right? And we have no opportunity to deny service, right? So if the taxpayer doesn't understand that costs are going up, that income is going down, and we need help, then I can't do anything else for you. But that is a reality. And 10 other towns in Monroe County have understood the model. We're the last one to do it, and I hope we'll, through this session and this process, the town will understand that we are a valuable service. We do what we say we're going to do. We've done it for the last 6 years and the last 35 years, and we need help.
Go ahead, Paul.
There was an increase in 2022 for the WEMS portion. Actually, WEMS revenue went from an average of about $1 million to about $1.5 million. So that was a result of the West Webster Fire District contract ending and then picking up more calls. So it did have a positive impact overall, but you know, that's the revenue side of it. There are expenses to go along with that.
That's right.
Let me add to something here. Let me add something to this. Am I getting interrupted?
Okay, can you hang on 1 second, Russ? I don't want you to speak from the crowd, so I'm going to restate your question because you feel that it hasn't been answered, but I don't want you to try and interrupt, Ron. So the question is, why are we not adhering to a legally binding contract? So I guess that either goes to Paul or to John.
We are adhering to the current contract, but at the same time, we're doing a due diligence to see where the town goes next with respect to EMS.
Yeah, I think if we choose to provide additional funding, then I think the contract is open for renegotiation because it's a different contract in my book.
Correct.
So it would be renegotiated, the contract that's there would be renegotiated if additional funding were to be supplied?
Correct.
Okay.
In my view. So I think that would include additional money and additional metrics.
Okay. So I'm going to just grab a question off the sheet because
Well,
it's...
I'm sorry.
Oh, go ahead.
With respect to the metrics, that is a discussion that the town board will have and the conclusion that we will come to as an entire town board. What that new contract, if we get to that point, will include.
Okay. Russ, did you want to touch on this?
Yeah, I did. Trying to take a little of the emotion out of this particular question is, why have things changed the last couple of years? Anybody in the room know about COVID? Raise your hand. Right? Businesses have changed. I'm a business owner. Several of you in this room probably are as well. Didn't some of us get PPP money? What, did we deserve that? ERC money? I mean, my call volume at Nova in 2020 was way down. We're doing 6,700 calls this year. In 2020, when nobody wanted to get an ambulance, go to the hospital, they were all scared. we were down to 5,000 calls. Our attrition rate in the United States for EMS providers is about 5% a year, which we refill with about 5% a year. But since COVID, we've had some states, not necessarily New York, have attrition rates at 30%, right? Still only filling, and now filling them with less than 5%. Like Ahmed said, 18 paramedics for the whole county of Monroe, that's crazy. So there have not just been some small changes that you could attribute to a single business. We have gone through catastrophic changes that demand that we have to relook at things like contracts, like how any business operates. But in particular, EMS and medical services has just been through the ringer. Nothing is the same.
Thanks, Russ. I'm going to grab one of the questions off the portal, which is, when will the town's NDA with NEQ end? Can you address that, John or Paul?
I don't know the exact date of the NDA. Do you, Paul?
I'm not certain that there's an end date on it. But it was, the intention was for it to cover during the period of the due diligence process, which in my mind is still going on.
Right.
Until we at least get to a short-term and possibly a long-term solution, I think that period is still open.
Okay.
I would agree with that.
A non-disclosure agreement. Rod Riesenberger, did I say that right, I hope? Rod, come on up to the microphone if you want.
Thanks for your time. I appreciate your, thank you for your time, and I appreciate your service, all of you. And I'm sorry for your loss this week. My primary concern is the long-term goal. I've been in EMS myself for my whole career, and I realize EMS is in trouble right now. So adding funds, taxpayer funds, to your current budget, I think is a Band-Aid. And I'm more concerned about perhaps making this more of a civil service position, giving these folks proper benefits, retirement, and so on and so forth. Where are you with that? Is that I'm assuming we're not going to see the rest of the slides behind this one, but I was able to see them earlier on the website, and I appreciate that. I think that seems to be a more viable plan to give our folks a little bit of maybe competition to come to Webster instead of begging people to come to Webster. Before the rest of Monroe County gets on board with this, I think maybe this is a good time for Webster to perhaps look at that long-term solution.
Rod, I think that's a great question. And as I've told this town board many a time, you will see the taillights of my boat when my people can work 40 hours a week and earn a decent living. That has been a statement of fact. I've said it a dozen times in town meetings. The reality is the current income model does not allow that to happen. And sure, it would be awesome to go to civil service. We wouldn't be asking for $400,000 a year. We'd be asking for $2 million, right? This is all about what you want to pay for. You pay for what you get, right? We have never denied an employee a raise at NEQ. They're sitting right here, you can ask them, right? We offer them benefits if they want them, which, by the way, we pay 100%. Not many other EMS agencies do that, right? We have built a base to make it a comfortable environment for them, right? We're working on getting good equipment. We have done everything we can to make NEQ the place it can. And as a result, Rod, we have no EMT openings in our schedule at the moment. One of the only EMS agencies around. Paramedics are hard to find, but even then, we're doing a pretty good job of staffing them. So money is one part, right? Part of it is culture. And we focus on culture, you know that, right? We do things to make sure that our employees feel valued. When they're having bad days, we make sure we're with them. When the ambulance debacle happened a few weekends ago, there was no finger pointing, there was no yelling, there was no screaming. We all got in there and we did our jobs, right? And that is what we're trying to do, and that is why I think NEQ has maintained. When COVID came, before we had our base, we lived in 4 bays of a garage. Our medics slept on roll-up cots in between ambulances, and we still kept all our staff. We have never been the highest paying agency. We've never had the best equipment, but we keep our rigs on the road. Part of that is because of culture, and part of it is because of leadership.
Thank you.
And the difficult thing with long-term planning with respect to EMS is that they are not considered an essential business, which I, for the life of me, can't understand.
That's kind of my point. is
Right, so
the police
that's why a lot of
department in our
communities
town
have
is
looked.
essential.
Right.
Right.
So
Why is it-
a lot of, I think there's like 10 municipalities that have ambulance districts?
Yep.
Is it 9 or 10?
10.
Right. So is that something that the town board is looking
9.
to consider? Absolutely. There's short-term goals, and that is one of the long-term goals that we are considering, and will be considering.
Thank you. So that grabs one of the questions that came in from the portal is why would the town tax residents for a service and then outsource it? Why we don't do that for other departments in the town that residents are taxed for, such as the police or the highway or the water treatment? So Jim, is there anybody else in the county that, any other towns that have their own ambulance service?
Yeah, the village of Honeoye Falls,
The village of Honeoye Falls does
which
it?
covers Honeoye Falls and Mendons, and those are civil servants. They're employees of the village.
So they're village employees?
Yes.
That were, and the ambulances are owned by the village, so that model is one that does exist?
Yes.
Okay, that grabs that question.
And their cost is a whole lot more than what we're asking for.
I don't know. I'm going to
telling
take
you
your
as a
word for it. I'm guessing that civil service always costs a lot more. Brian Gutman, would you still like to ask a question? You're going to pass? Okay. Kevin Rampf? I hope I said that right. I'm trying to read handwriting. Is that right, Kevin? Okay.
If the town collects some money for NEQ to operate WEMS, why hasn't this contract gone out to bid? New York State municipal bidding process says that municipalities will put contracts out to bid. This contract has never, ever gone out to bid. And there are other agencies within Monroe County and beyond that can handle this.
Thank you. You want to, Paul, I'll start with you.
Well, I think this would be considered professional service, which is not required to be put out to bid, although it's always good best practice to test the water occasionally, but in this case, it's very specialized and it's a professional service, so I think
John.
that's the reason.
And I believe that that is one of the options that's listed that we will be discussing as the town board.
So they're not required, but they could if they wanted to?
Correct.
Yeah.
Tom, okay, good, good. Next up is Ed Wilkowski. Pass. Dan Cody, you're next.
Hi, I've lived here for 33 years, been a member of West Webster for that time, was in EMS, so I understand that. And I also understand contracts. I was purchasing manager for 20 years. A contract is a contract. If one party fails to uphold their side of it, the other side needs to do something, and if they can't, it has to go into default. It looks like this situation that we're in is a result of inadequate planning on both sides. It looks like NEQ bit off more than they could chew, and it looks like the town tried to do one-stop shopping for their EMS situation. It doesn't look like there is a viable business plan going forward of what we're going to do with this money. I think the taxpayers of Webster are entitled to negotiations that are in the open, with contracts that are precise and detailed, and that have the contingencies of doing business going forward. I'm still a little in the gray area about that NDA. If NEQ comes and asks for money, there should not be an NDA still in effect. We should be able to look at all of their finances, wherever they're coming from, wherever they're going to. I'm wondering what that NDA is actually sheltering, and I'm wondering what it'll show if it is, and when it should be opened to the public. Also, from a financial point of view, I'm wondering if NEQ is a top-heavy organization. the paramedics, the medics on the road make $17 an hour. I'm wondering if management is a little bit over the top. So I was just wondering that dollars and cents are dollars and cents. A contract is a contract. Thank you.
Okay. I pulled a question out of that with regard to the NDA, I think, but I don't know that we could give it an answer.
I think we've already addressed the NDA
I
issue.
think we've already addressed the NDA, and I
We
think
addressed the
beyond that, what the
contract issue
legal
also.
requirements might be,
Right.
we would have to get from the town attorney. Next up is, I think it's Anastasia Nedelkos. Did I get close? I apologize. So why don't you go ahead and state your name so that we get it right?
Yes, it's Anastasios Nedelkos, and it's, well, since 2000, well, before 2009 in this building, it's been butchered worse, I promise you. I speak, I guess, on the behalf of being a patient of various ambulance services over the years. I have a genetic heart defect, unfortunately. And so I've ridden with everybody. I've ridden with West Webster, I've ridden with Ontario, Williamson, not by choice, and the Webster ambulance as well. Unfortunately, the last time I had to ride with anybody, it was with WEMS, and the service was not good. It was very poor. And so coming from the side of being a patient, I don't know that, I don't know how to word it. I'm sorry, I'm unprepared. But I'm concerned that the money wouldn't fix anything potentially. Potentially there's a deeper problem somewhere within WEMS that's unknown or unfound of yet. I don't think anybody should have to be told, you know, oh, just go to urgent care, we're not going to take you, even though you called 911 and requested an ambulance and the ambulance didn't take you. My mom fell in the front yard and broke her nose open, and the service pulled up and they're like, just go to urgent care, you're good. And with me, I had a heart issue, and they came in with no equipment, they didn't monitor me, nothing, walked me out the door, and took, you know, half an hour sitting in the driveway before we even got to the hospital. So my concern is, will the service actually improve? I don't think it's, I mean, I've had better service all these years from every other agency so far, so it's kind of unfortunate.
Thank you. Ahmed, I'll let you have it. Will the service improve if you're given additional funds?
I think, first of all, I'm sorry that you had a bad experience with us, right? I cannot discuss the call. I don't know enough about it. But here are the people right there. Why don't you ask them if the service is going to improve? We put out pretty good service day in and day out. You had a bad day, and I'm sorry for that. But I would be willing to say that 95% of our patients don't have a similar experience. We have done patient surveys for years with scores well over 4.7 out of 5 consistently. So I'm very sorry that you had a terrible experience with us. We can talk about it afterwards, so I won't discuss any patient-specific issues openly. But the men and women are right here. We do not provide bad service in Webster.
So next up is Susie Nedelkos. You're going to pass? Okay. Next up is Lori Reynolds. Good job.
Thank you for letting me speak. I'm Lori Reynolds. I'm the chair of Webster Citizen Action League, WeCal. We've been an advocate for the town of Webster residents for, this is going on 10 years. And I'm representing WeCal right now. And I'd just like to make a statement that we feel an ambulance district is not the answer. We feel the answer is to make it a town department, like the police department, and that way there'd be transparency and more control. And personally, myself, I also am a patient of EMS in April twice. I had good care the second time. First time, what happened was I was hemorrhaging from my nose. Both times it was bad, very bad. I had EMT came to my home. The first time, they weren't prepared. They couldn't even get a blood pressure cuff on me. They took me to the hospital. My husband and my family could have taken me to the hospital. I wanted to be helped to, at least on my way en route to the hospital, to stop the bleeding or do something. I bled the whole time, no siren, as slow as you could go to general. Second time was within, short time after that, within the next week. I had paramedics. It was the same situation. I was bleeding. I was losing blood, majorly. I had a lady that was very helpful, put 2 IVs in me, and comforted me. I didn't have that with the first ones. They put the siren on and sped me there as fast as possible. So I don't know where I stand with this personally, but I'm not happy that of what happened with their first time. The second time, I was much happier with them, but anyways, I've told you how weak health stands. So.
Thank you.
Ms. Reynolds, you know, as we spoke to Mr. Natalko, you know, I'm sorry you had a bad experience. I'm glad your second was better. But as we've said earlier, if the town wants to fund a civil service ambulance, we will gladly support that, as long as this town has the stomach for the expense that it will generate.
Jerry Ippolito, you're going to pass? All right. It looks like, is it Barry Pugh? P-U-G-H? Did I say it right? Thank you. What's your question, Barry?
I'm just going to be very brief. Since my retirement from the service, I have had service with Webster EMS multiple times. Over the last 2.5 years, I probably had to be taken to the hospital over 16 times. Heart conditions, lung conditions, and I've never had any problems with Webster EMS. I praise every one of them. Very professional with me. I'm sorry about anybody else that didn't have those situations, but that's my stand on Webster EMS.
Thank you.
Thank you. Thank you for your service too, sir.
Thank you. Karen Mustafa.
Got a whole thing prepared, but I just have a couple questions if you guys could clarify a couple things for people that might not understand. Before you were talking about ALS and BLS, can you explain the difference between ALS and BLS and why you might have an ALS rig versus a BLS rig? Also, just at the beginning, Supervisor Flaherty had mentioned that $800,000 that kept going around and around. Wanted to know if that was an actual number or just an idea of a number that might come up, if that was just a fabricated number that was thrown out to be used as an example. And lastly, not that I've lived this the past bazillion years in my house, where my husband does this every day on vacation, we have the phone ringing all the time about ALS, BLS, EMS stuff. If you go to a patient's house, you assess a patient, but you don't transport. Are you paid for that service that you've provided in the house without transporting?
Okay.
Just to clarify some things.
You got 3 in there, so
I
I'll let
did.
you sneak in with 3. That's all right. So let's start with the one. What's the difference between? I'll let Russ handle this one because he's just been sitting there doing nothing. No, I'm just kidding. So ALS versus BLS. Russ, want to talk to that?
Sure. ALS stands for Advanced Life Support. BLS is Basic Life Support. If you have a call, can be considered ALS or BLS. For instance, a sprained ankle at a baseball game would be BLS. It doesn't require any advanced things. BLS calls only require the level of a basic EMT. An ALS is more advanced calls, such as heart attacks, strokes, hemorrhaging, trauma, and requires advanced care of a paramedic. The difference between a basic EMT and a paramedic is some significant education. A basic EMT, you can get in about, somewhere around 6 months of education, and then on top of that, you'd have to add another year or 2 years to become a paramedic. And so when it comes, the other difference is in how those things are classified by the insurance companies. ALS is classified differently than BLS, and the reimbursement rates are different. They reimburse sometimes slightly more, sometimes quite a bit more for ALS, depending. Like I said, the Medicaid, I told you before, there's not much to add to that, but in commercial, your ALS and BLS will be reimbursed differently. Does that answer?
You want to talk about the paid for no transports?
Oh, the pay for no transports? There are, yeah, that's a tough one in EMS. We don't get paid for no transports, and if we do, it's insignificant. It's certainly not paid by the insurance companies. That is a self-pay thing. So if you are an unconscious diabetic and our paramedics from any ambulance respond to your home, and it's one of the times that we actually can significantly impact a life is by giving you an IV and giving you some sugar. So we've treated you, and you wake up and you say, I'm a diabetic, I've had to be treated many times this way, I'm not going to the hospital. So we've had some significant expense, and sometimes reimbursement will be somewhere between $0 and $50.
So that goes to one of the questions we got at the portal, which is that when I call... Oh, I'm sorry, Tim, go ahead.
I just wanted to clarify something on insurance. So different insurance companies pay differently. So there are codes that you can use for treat and no transport, and the insurance companies will reimburse you, usually at a fraction of the transport cost. The other thing with the patients getting the check instead of it being sent to the provider, service provider, that's an option. So EMS, like blood labs or like x-ray labs, can be what's called a participating provider with the insurance companies. If you're a par provider with insurance companies, they'll deposit the check into your account, not send it to the patient. So there is agency in Monroe County that is a par provider that doesn't have these issues because they have an agreement with the insurance companies. But when the insurance companies want you to be a par provider, they expect you to reduce your cost to give them a discount. So a lot of agencies can't financially support being a par provider because the revenue gets so low. So I just want to clarify.
It's a spreadsheet issue, right? You have to figure out how many patients are going to keep the checks and what is that going to equal, and is my total revenue or my billings minus the checks the patients keep going to actually be less than the billing everybody getting 100% but billing them less. And for most agencies, it's don't participate, you don't participate. But I mean, there's certainly going to be payer mixes in the minority where you can actually participate and still maximize the revenue that you can have.
Russ, is your organization a participating provider with any of the insurance companies?
Well, we're mandatory participants with the government.
Yeah, well, other than the government?
No. We are mandated to accept the rates that they tell us to anyway, but we don't participate, no.
You're not a participating provider, right?
We are also with Medicare, Medicaid, but not with private.
Right. So I want to just grab one of the questions that came off of the portal. When I call for a lift assist and WEMS responds, I get billed, but when Penfield responds as mutual aid, it is free. How do other agencies handle lift assist and/or calls for vitals but no transport? I think you've touched on that a little bit, but do you want to maybe elaborate on why there might be a difference in billing between agencies?
So I can't address Penfield's billing process. I don't know the answer to that. And I don't know if the lift assist was a lift assist with any medical treatment or care, so that question is a little too vague to address. If treatment is given and the patient still signs off, there is a bill generated.
Okay, thanks. Next up on our list is Don White.
So I have one comment and then a question. The comment is, and I'm actually surprised I'm saying this because I'm the last person that would ever consider expanding government, making government bigger. But When it comes to providing ambulance service, EMS care, I think the town of Webster should seriously look at long-term having it be a department of the town. I just did a brief research, and while the model in Western New York is not municipally owned ambulance services, downstate, the capital area, it is. So you got to look beyond Western New York for comparisons. Quickly, I looked at the town of Colony, which is the largest suburb of Albany, 80,000 residents. If you look at their last year, their expenses were roughly $5 million for their ambulance department service, and their revenues were $5.7 million. They made money. So, Ahmed, I would question your off-the-cuff conclusion that it's more expensive for government to do it. It may not be the case. It may not be the case. My question is, in the short term, and because there's this contract that goes to the end of 2025, the town is a bit handcuffed in what short-term solutions it could consider, unless Nequals WEMS is willing to seriously renegotiate what's left of that contract. And in that renegotiation would, and I'm confused, it's unclear. Ahmed said that audited financial statements weren't provided to the town. The 990s, that's a tax return. That, you can't tell anything from a tax return. And I'm unclear as to what exactly Paul Adams looked at. It doesn't sound like he looked at audited financial statements from WEMS. In any renegotiation short terms, is WEMS willing to provide its audited financial statements to the town of Webster? Beyond an NDA, so that it's available for the public to look at.
Okay, thanks.
Don, I did see the audited financial statement for 2021 and for the years prior to that. It's just 2022 is not available yet.
I believe the date for the 2022 will be the end of June, you said?
That's what they're targeting.
So sure, yeah.
So the second part of that question, Ahmed, is will you, in the part of that renegotiation of the contract, if that were to come, would you be willing to make your financial statements public?
Well, as I said earlier, we have to be careful, right? Our financial statements give our competitors an advantage. So we will have to do so carefully and with proper legal counsel.
Okay.
And to your first point, Don, though, one of the things, as I said earlier, is this payer mix stuff. It's very the levers are actually pretty huge. You move this one stick, a millimeter. Like I said, that payer mix go from 17% to 15%, and my organization would go from having some surplus cash at the end of the year of about $250,000 to about a loss of $250,000. 2% will do that. So you can't compare a suburb of Albany at 80,000, the town I come from 60,000, so it's similar. You can't compare that. You can't compare any two zip codes, any two geographies without a serious investigation into how that payer mix has looked over time and over the years. Right? It's just
Makes sense.
It's not worth even bantering about, because you have to have that information and that data to make a predictive model.
And one other thing that I'll tell you, Don, I pulled up Colony EMS's payroll. Their starting paramedics start at $22.30. Every one of mine makes more than that. Their paramedics at the end of 10 years make $26.96. Half of mine started at more than that. So yeah, you will make more if you pay less. You're in a more competitive environment. I'm fighting here with eight districts to get over $4 million to keep their staff, and Wayne County EMS has just gone to civil service. So yes, our expenses are different than Colony EMS.
Okay, next up is it David Ogie, OGI? Close enough? OG maybe?
I have a background in EMS. I was an EMT at a volunteer organization in Parenton, and I was the director of operations when we went through the process where we had to convert from volunteer to paid people. So I fully understand what you're going through in Webster EMS with the insurance companies and with your Medicare and Medicaid. My question to you is, how are the two commercial ambulances, AMR and Monroe, still turning a profit with all of the problems that they're having and you're having with the reimbursements from the government?
You know what, Mr. Ogie, how do you say it?
Is it OG?
Ogie, Mr. Ogie, you'll have to ask them.
Well, I mean,
No, you'll have to ask them. We don't do Monroe and AMR's finances, you'll have to ask them.
That's fair enough, I guess. You want to make any comment, Tim? Commercial versus?
No, I mean, one of them is a family-owned business, Monroe Ambulance. The other is held by a private equity firm. So we don't look at their books.
Okay. Sue Casey. Are you here, Sue? Here she comes. You can pull that down, just grab the handle. There you go, and it'll move down.
There we go.
There you go.
So if the special tax district is approved, who will approve any rate increases going forward? And will they be subject to the tax cap?
Okay, thanks, Sue.
I believe it's a town board that sets the rate. As far as it being subject to the tax cap, I can't answer that question right now.
Paul, do you know? Would that tax district be subject to the tax cap?
It will be part of the tax cap calculation, which is, they say 2%, but it's 2 to 3% a year, max.
So just to
on your
clarify
tax
a little
levy
bit,
increase.
this district, if it were to be formed, would be like a park district or a water district or a sewer district, rather than like a
special.
fire district that has its own separate board and its own separate entity. This would be a district that falls under the town board.
You know, I think it would be separate like the fire district.
No, it would not. So if I could,
wrong on
and
that.
without giving a legal opinion, Mr. Genesi, if I'm wrong, correct me. But anytime a special use district is formed, the town board becomes the board for that special use district. Now, it is not our full budget, right? But certainly, if that was to happen, there would be a much different level of cooperation and collaboration with the town. And I want to be very clear, right? We have worked very closely with this town board for 35 years. We started the ambulance service together, right? Some of the challenges that we're facing and the discussions that we're having are normal, and quite honestly, you know, last July, Supervisor Flaherty and Councilman Cahill said we'd have this meeting, and we're having it, right? We have been very transparent with the town. They have had full access to our QuickBooks. They have had the available audited financial statements. There's no smoke and mirrors here. And if the town says, hey, to ensure that WEMS will survive, we would like to do things, as long as those things are negotiated fairly and to the benefit of both organizations and the community, there's no reason not to do it. We're not holding out for anything. We're not
No, I agree.
Okay.
Yeah, just to be clear, I think you're right. It would be a special district within the town's tax cap.
Am I correct in understanding that the town would set the rate?
Town board.
Town board, yeah.
The town board, the rate would be set based on the budget which is approved by the town board.
Right, thanks.
Okay. Next up is Ken Corpus. Ken?
Good evening. Hi, Barry. How are you?
I'm good, thanks, Ken.
Thanks to the town board and Supervisor Flaherty for this opportunity. I think it's great. I had a bunch of questions that have been answered, but then after listening to everything that went on, I got a lot more questions. So I'm going to go with Ms. Mustafa's theory of 3 questions.
As long as they're brief, Ken. We got another dozen people.
So given that there's 17 agencies in Monroe County, is that correct, Tim?
17 transport agencies.
17 transport agencies. Of those 17 agencies, how many have metrics?
Have performance metrics?
Yes.
I'd have to leave that up to those different agencies on what they measure. So there are standard performance metrics that were adopted by Monroe County Office of EMS and the EMS Advisory Board. Those can be found on the MELREM's website. And those performance standards are everything from response time reliability to accidents to vehicle breakdowns and it's very, very detailed. So while those performance metrics are there, we want people to strive for them, but some of them are going to be almost impossible to meet. Like, you can't have an ambulance never break down and be up 100% of the time. But they're goals, and everyone should be working collaboratively towards those goals. And each of those agencies usually has their own quality assurance system, which looks at their own internal metrics. We don't look at them as a whole from the county, other than through Dr. Cushman, who is the county medical director.
Okay. There was mention of the 990. I have it right here if anybody wants to see it. There's 2.9 million in revenue and over 528,000 left at the end of in what they call balance funds. So year over year, there's been a balance fund. I don't get to see the financials. I'm just looking at what's provided to me publicly. Can you tell me what is different than this than what's actually in the financials?
What year are you looking at?
I have 21 right here.
Yep, so 21, we had a hell of a reserve fund because we were building a building, and that was all consumed by the down payment of the construction. It all disappeared in 2022.
Okay. So we'll be able to see that when the 2022 comes out.
Yep.
And last one, Ken.
Pardon?
Last one.
Thank you.
Brief.
Given the numbers identified in the slides that were up there, in order to continue to fund your organization, it was mentioned that you didn't ask for any changes organizationally or operationally. Why would we, as taxpayers, want to fund this operation if we're not going to have any organizational or operational changes to make it better and provide accountability?
Well, I think you asked three things there, Ken. So organizational and operationally, why don't you ask all these people right here? Are we a poorly run or poorly operated organization, right? Ask them, because they work for us, and I'm sure they wouldn't if it was. As far as your last question, which now I just completely forgot. Sorry, Ken, what was the last one?
Why would we fund extra?
Why would we continue to fund this, give you more money if there's not any organizational, operational, or accountability included in it?
Yep, sorry, thank you. All right, so organizationally and operationally, you can go ahead and ask our staff, you can ask any of our line officers if we're a poorly run or poorly operated organization. Accountability, we have traditionally always given reports to the town, usually in January of our prior year, right? The last few years we haven't been as rigorous about that. There are no secrets. If the town would like to set metrics and they're logical metrics that are achievable, then we're 100% for that, right? We have a QA/QI process. We do all the things that other agencies do or we strive to, right, within our means.
Okay, next up is Charlie Conrose. Charlie, what's your question?
Simple question. What year did you actually start this ambulance squad? Okay, 35 years. It hasn't been 35 years. I just started seeing Webster Ambulance a few years ago when everybody else was put out of business. That's my first question. My second question is really simple. How much of your money did you put into this thing to get it started? How did you ever get it started? I'm a businessman, okay? 54 years a businessman. You don't start a business and just borrow and borrow and borrow. I started with money ahead of time because I knew I wasn't going to make money in the first 2 or 3 years. How did you get it? I just can't understand how you're doing it, other than borrowing from me, a taxpayer, everybody else here, a taxpayer, and you got the town board on your pocket. It's just ludicrous to me. Now, I know you're going to give me all the smooth answers that you're going to give me, and everybody's going to help you. But as a businessman, I don't like what you're doing here. I just don't like it. It just doesn't seem like it.
Thank you, Charlie. 2 questions in there. The start date from when EMS,
Yep.
Webster
So
EMS came to be?
NEQ has been around for 35 years this June. We just celebrated our 35th anniversary. We started WEMS in 2016, October.
And Capital Inn?
Not 35 years ago.
We didn't say 35 years ago. NEQ was founded 35 years ago.
Difference between NEQ and WEMS?
Right.
And Capital Inn?
Yeah, so all the capital came from NEQ's budget. We had allocated for it, and we have operated this with 100% NEQ funds. You can ask those that have looked at our books, we have very little debt for our organization. We do not run on debt, and that's why we don't take loans that we aren't sure we can pay off.
Scott Seidman. Did I say that right, Scott? Okay. Scott, what's your question?
Please be assured, my only real interest here are making sure that on what may be the worst day of my life someday, if I call 911, a viable ambulance service is going to show up that's capable of transporting me where I need to go, and that my tax money is spent responsibly. Right? So that's really all my interest. Now, when you start talking about your reimbursement model, I 100% appreciate the COVID thing. It's really changed the employment model and the employee availability. It hasn't substantially changed your reimbursement model too much. And we're really looking for an organization that understands their reimbursement model sufficiently to not have to come back for a 30% bump in their contract, right? And it just seems irresponsible that given that's where we ended up, that we're not really demanding to bid out our next step. And then the other thing that kind of gets to me, if I'm going to hire a contractor to do something, the contractor's going to give me a price. I'm going to determine if it's the right price and if I can meet that price. And if I can, I'll hire him. But it's not really the contractor that's going to come to me and say, oh, you don't have enough money to do this. Maybe you should go to Louis down the street and Louis will fix you up. And that's how I really look at the request for a tax district. Why is it your business how we pay for our service? Is that a fair question?
Well, I think we can work a question out of there. Can you get that one, Ahmed?
No, I don't know what the
Why?
question is, so I'm not going to address that.
Why is it fair that the taxpayers should fund EMS?
Well, I guess looking at 9 other towns and many other in the state, when the cost of readiness exceeds the available income, we need support from the community. You pay 100% for fire and police.
Why do you care where that support comes from the community, as long as the community is giving it to you?
I don't care. I don't care what the mechanism is.
I would really encourage the town board moving forward to treat all of these as separate issues. We shouldn't be wrapping up the tax district with who's going to be providing our service. There's no reason for that. Anybody could provide our service, and we can make a tax district if we need to make a tax district.
Okay.
Right? And the short-term and the long-term question about who are also different questions. So I try not to conflate these. It makes for 3 much simpler problems. Thank you.
Thank you, Scott.
Thank you.
Emily Bitgood, did I say that right? Is it Bitgood? Emily, what's your question?
Good evening, and thank you to the EMS who are here tonight for all your service to this community. I wanted to just touch off what the previous gentleman said, and I think that that's an important thing to discuss about conflating these issues. My primary concern is that I believe the town should be putting the funding behind this service. I'm happy to pay as a taxpayer an extra tax to support this very critical service. But I really think that the town should be funding this, that this support should be coming from the town board. So my question is to Ahmed and to Russ. Yeah. I'm wondering if you could paint a picture, provide a hypothetical. If this agency does not get the funding it needs, right, you guys are operating on razor-thin margins, what is that going to mean for every person in this room here if we do not have ambulance service coming from this community? What would that look like if I were to, God forbid, or anybody in here, God forbid, to have an incident where they needed service and it was outsourced or put out to bid like these other people are suggesting, and it's no longer in-house? That is a very scary issue to me, and I'm wondering if you could speak to what would that look like if we didn't have it in this community anymore, because that is a very difficult situation, and so what would that mean for us?
Sure.
Thanks, Emily.
So one of the things that I would tell you from my experience watching agencies go out of business over the years, as to wrap in a little bit of what somebody else said, how you manage money and why is reimbursement our problem. I mean, I told you the average reimbursement of Medicaid we get is $236. That's up from $227 20 years ago. So, we do see ambulances go out of business. And one of the problems that you see when an ambulance goes out of business, I talked about the attrition rates. We see about half the people who leave EMS because their agency, their full-time agency, has gone out of business, do not re-enter the EMS world. So the number of calls in Webster, however many thousands it is, that won't change. And if another agency, doesn't matter who we're talking about, were to be doing the calls, where they still need this, where are they going to get the people? Right? So what's going to happen is we're going to have a reduced EMS staff. I mean, we're seeing this. I'm not making this up. These are stories you can see throughout the state and throughout the country. So what that's going to translate to, quite frankly, is enhanced response times. Now, I live up on across from Hedges, which is already a long haul. So I think, what I'm going to tell you from my professional experience of 30 years is the minimum thing you're going to see is increased response times, right? And that is going to have a negative impact. Now, that doesn't mean, I'm certainly not saying that I'm, anything against all the options we're talked about. But however we do it, we have to figure out a way to do it so that we can have the same number of people providing our services or more coming from a similar or closer location. And that's a question if somebody asks right now how you would do that. I don't know if anybody at this table would be able to answer that.
So go ahead, Tim.
Yeah, I'd like to comment. So in Monroe County, we have had agencies close and merge. So in my village, in my town, Scottsville, the ambulance merged with Henrietta. So it's Henrietta, Charlotte, Caledonia, and Scottsville. Brockport and Spencerport merged. So in those communities, when they talked about going out of business, they were proactive enough to say, how do we do this so we do not impact the response time reliability? We do not negatively impact our residents and our patients. And the EMS agencies that have closed in Monroe County have been very good at doing that. They do patient care for one reason, because they love people. And so they're not going to let their communities down. If they have to transition out into something, they're usually very good at doing it.
So that grabs one of the questions that came into the portal, that NEQ has indicated on multiple occasions that they're in financial difficulty and that continued operations are in jeopardy. Has the town prepared an immediate contingency plan to provide ambulance service to the Webster residents that may include options such as a neighboring agency or agencies, maybe Penfield taking back the West Webster Fire District, and or commercial services such as Monroe and AMR? I'll let you field that one, John.
Sure. Well, that's why we're going through this due diligence at this point right now, so that we can come up with a viable short-term resolution. And I know that Penfield is one of the options that we will be talking about and looking at. So that process is ongoing.
Okay. Next up on our list is it Josh Jonas? Passing. Anthony Sutera.
Basically, one question, like clarification on a question that was raised before. I didn't quite understand Paul's response. I guess my question is, everything we've seen so far, nothing goes back to the quality of service that's being provided. Your prior presentation talks about calls for service, but it doesn't define response times, for example. People here said they've had bad experiences. If you need to have a baseline in which to measure, to say, if you're going to use tax dollars to give to a company, we should see improvements, not just to keep them afloat. Now, I'm another person who didn't particularly like their service because it took 20 minutes for an ambulance to show up, and my grandson cracked his head open, was bleeding, and 20 minutes is unacceptable. So where's the comparisons of baseline to other towns, baseline to what Webster Fire Department did prior to them taking over? We don't have any of that information. Yet you want us to give more money to the company. And if I'm not mistaken, one of the short-term things on your last presentation, unfortunately, I didn't make that meeting, was if we wanted metrics, we have to pay for the metrics. The metrics exist. Why can't they provide those metrics? I know all first responding agencies have response time metrics. I worked with public safety agencies for 15 years. It's one of the key things that they use to manage their environments. So I think we're missing a big piece. We keep talking about adding money to something, and yet we don't understand where we are at a baseline, other than the fact that they're losing money and they need money.
Okay, thank you.
And just to clarify, one of the gentlemen mentioned the bid process, and I thought you said that didn't apply. But what does apply is a request for proposal. I mean, I've written many of them when I worked in the public sector.
Right.
That's the place where you define requirements. And also, what didn't get mentioned, we ask for metrics we have to pay for. Are we going to hold them accountable financially if they don't meet those metrics?
Okay.
I mean, I think we need a baseline of public safety to measure against if we're going to give anyone any
Okay.
more money.
All right, thank you. Thank you. So, the contract that we currently have, does it call for metrics? Does it call for response times? Does it call for
No,
any
it does
kind of
not.
measurements?
No, it does not.
Okay. Do you have metrics? I think that in the past you've supplied the town with metrics, Ahmed?
Yes. I mean, we measure a lot of things, and we have provided the data to the town. I will caution you against response time metrics, because more and more often, we are not running red to calls. It is proven to, A, have very little positive impact on the patient outcome, and B, greatly increases the risk of accidents en route to calls. So we are actually reducing the number of calls that we run red lights and sirens to, and the number of calls that we actually transport a patient to the hospital is even fewer. So response metrics is not really a great one. As Director Sopransky said, there are metrics that we do hold ourselves against, that the county has set up, and we have reported on those. We do measure those internally. We've not done that with the town. In 2021, I think the supervisor asked us to look at the existing contract. Some metrics were proposed. Was it 2021, Tom?
Yes.
Right? And, we gave some suggestions back, and then that process stalled.
Correct.
Okay.
Just to be clear, though, when you say we don't necessarily go lights and sirens, that's not an NEQ WEMS thing.
No.
That's either industry, right? That's a county decision.
Well, yeah,
On-
and
on-
actually, the response time configuration has been in flux for many years. When I was at Rural Metro, we started going non-lights and sirens to non-critical calls, vastly reducing the number of accidents and injuries to our personnel, and no patient detriment as a consequence of it. So really, when the call comes into 911, the call taker grades it through a series of questions that drives additional questions that drives the response time metric, which is defined by Dr. Cushman as the oversight physician for 911.
So I was just wanting to make sure everybody understood that it's not coming from the CEO of Equals, or even you. It's a systemic
It's a
decision
system
that
approach,
we don't
yeah.
have a choice. We have to play by those rules.
So one of the other things that's worth mentioning is we do not dispatch ourselves. We do not take the calls. The patient's call is sent 911 center in the county, and depending on what you tell them is how we get dispatched and the priority of our response. Somebody falling down and bleeding is not necessarily a life-threatening emergency. We may take that call in service. That means we stop at the red lights, we stop at stop signs, we obey the speed limits. So it's based on the information provided to the telecommunicator that is then relayed to the dispatcher, then is relayed to us. That is what determines our response. We respond based on the priority of the call that we are given, not on what we feel. Now, that may change over time. So if the person that fell, the bleeding is significant, and they're bleeding, from their head wound, and it's a major event, and they call back or upgrade it, then we will upgrade our response. But as we have all said, we are trying to minimize our red lights and sirens response because it provides very little positive improvement to the patient and greatly increases the risk to the responders and the citizens that we're responding through.
So while we're on the topic of response times, the question from the portal is that what is the differential in response time from Webster EMS handling the call versus an outside agency handling the call? Basically a mutual aid.
That's impossible to answer. Yeah, that's impossible to answer. It depends where you're coming from, time of day, nature of the call, response category. That is too vague to answer that question.
Okay. Next up is Garrett Wagner. Are you still here, Garrett? He's going to be a pass. And James Cometh? James, what's your question?
So one of my questions actually got answered in the portal earlier, so I'll just kind of keep my comment brief. I just kind of want to touch on a question that was asked earlier on the, if it goes to another agency and it's not an in-house or in this community ambulance, how does that affect response times? And there's a comment that it could increase response time. So I just kind of want to make more of a point, I guess, or my question is, how do we know that that's true? Because an example I have is, if you stand at the corner of Gravel Road and Ridge Road right now and call for an ambulance, you're waiting for it to come from Jackson Road. You know, depending on time of day to their point, it could be 10, 15 minutes. However, there's another agency's ambulance within eyesight of that intersection that won't respond because it's not in their jurisdiction. So, you know, if that agency was to be giving that portion of the town, and I'll say it's Penfield Ambulance. So Penfield Ambulance keeps an ambulance at West Webster's Firehouse to cover calls in the town of Penfield portion of the West Webster Fire District. So if you live in the town of Webster portion of the West Webster Fire District, you're actually waiting for an ambulance to come from further away, not an ambulance that's closer. So if you live in any of that region, you're waiting for an ambulance to come from Jackson Road, even though there's one sitting on Gravel Road right now. So.
I'll answer that question if you don't mind. So the Penfield ambulance is only stationed in Gravel Road for 12 hours a day, 5 days a week, I believe, not 7 days a week. So for the other 12 hours of the day and 24 hours of the 2 days of the weekend, you are getting an ambulance from further. And Penfield has been very clear that if they get busy in Penfield, that ambulance gets pulled out and they go down south, whereas Webster ambulances stay in town. That's my understanding.
So all I'll say to that is, I mean, and you can look at the fire district's contract, and I won't belabor it because I'm not here. I'm here personally. I'm not here as a representative of the fire department, so I want to make that clear too. But Penfield had, and you can ask their DO, they had agreed if they had the entire district, they would have put 2 ambulances 24/7, one being ALS and one being BLS. Currently, they have the one 12 hours a day. And it's not often that I've personally noticed, I can't speak to their data, but it doesn't get pulled out that often, other than when it is running on calls. So,
Thank you, James.
Hey, Mr. Howard,
Thank
one more
you.
comment. So, though we have different patches on our sleeves, our collective interest is always in patient care. Just the other day, there was, to Jimmy's point, or sorry, Mr. Cumeth's point, a high priority call that Penfield ambulance was closer to. And WEM's staff did dispatch Penfield to go first respond because geographically they were closer and they were available and we were coming from a distance and it was a very sick patient. So when the need arises, we do ask for help and we do use our brother and sister EMTs and paramedics to lend assistance because it's not about the turf, it's not about the patch on their shoulder, it's about patient care.
Okay. Bob Anderson. Going to pass? Does that include Debbie passing? I got Bob and Debbie on here. Okay. Next up is Colleen Capogreco. Kathleen? No? How about Steve Hurlith? Is there Steve here who wants to speak? And the last one, it looks like it's Kathy, and I can't get any more than that. It says it's from West Webster. Kathy or Kitty or Katie. Starts with a K and ends with a Y, that's all I got. Is there anybody there that wants to speak? All right, we did a pretty good job. So we've gone through the list that we've got. Is there anybody else? We've got a few minutes, a very few minutes, before we'd like to finish up. I want to just quickly make sure that I've covered everything that's on the portal because those people are not here. And I want to make sure that there's 2 questions that are left on the portal questions. The first one I think we've answered, and that is that are the financial conditions impacting NEQ and its repeated requests for additional funding particular to NEQ, or are they industry-wide conditions, perhaps driven by COVID? I really think that question maybe has been answered earlier with the shortage of paramedics and with the changes. Anybody want to elaborate on that one?
I don't think so.
I think it pretty much has been covered, right? And then the last one that's on here was, if the town chooses to do an RFQ or a request for proposal, how long would that process take? John, do you?
I've heard anywhere from 3 to 6 months that process could take.
Does that sound about right, Paul?
I don't know.
Yeah, it does. I think it'd probably take about 3 months to locate a new provider, and probably another 3 months for them to get up to speed and ready to go.
Okay. Is there anybody else in the audience? Yes, sir, you want to come up to the microphone, please? Well, here, let me just tell you what the issue is. This is being recorded, and you there with the back of your head doesn't help the recording. I need you to come up to the microphone, please. Okay. Anybody else that would like to speak? Yeah, Don, go ahead with question number 2 for you. Number 4, I should say. Yeah, there.
Yeah, I would have asked them.
It's not a question. As most of you know, well, up here, you know, I'm the attorney for the Village of Webster. If you're considering an ambulance district, the town cannot establish one that includes the village without the village first passing a local law subject to permissive referendum agreeing to join that district.
Correct.
So, I would hope that if you're thinking of an ambulance district route, you include the Village Board of Trustees in those discussions.
Good point. Thanks, Don. The gentleman in the back with the glasses on. I don't know names, so please come on up to the microphone, please. Oh, you did come up once before. I apologize. You were the first guy on the list.
No problem. My question goes to governance. He just brought up a very important point. Somebody had discussed earlier who would be the commissioners of this district that you're talking about. My question is, NEQ's budget is about $3 million, 2.9, I think was what it was on the 2021 990. My question is, you're basically looking for the taxpayers to fund a third of your budget. What will the town get, and the village as well, in terms of governance on the NEQOLS board? When the federal government invested in GM, they became one of the major stockholders. Are a third of the board seats going to go to town representatives? There's a whole bunch of questions around governance that we really haven't gotten into, in addition to the questions about financial need. So,
okay. I'm not sure that could be answered tonight, but I think it's a good point to make.
No, it's a very good point, and Don, you made a very good point also. And those are things that, as we look deeper into what's involved in a tax district, those issues will be addressed, and we'll be speaking with other towns and municipalities that currently have ambulance districts in them.
Okay.
Yep.
There was, that young lady right there in the third row.
Mr. Redmond, while we're waiting for Jan, if I couldn't just make one
What's
comment.
your question, Janet?
We have had a very collaborative and collegial relationship with this town board. For some reason, it's being perceived as a very adversarial one, right? If governance and whatever has to happen, it will not be done with resistance, right? As long as the metrics and measures make sense and can be measured and are achievable, there's no reason not to do it. We're not trying to have a bad agency, right? We have not survived for 35 years because we don't do a good job. We have not been in ambulance service for 6 years because we don't do a good job, right? So please don't perceive. I don't know why there's this perception, but I want to put it to bed from NEQ side at least. This is not an adversarial relationship. We have a town board member that sits in our board meetings every single month. We're the only EMS agency in the county that I know of that does that. And we do it with open arms, and we welcome Councilman Cahill when he comes.
Thank you, Ahmed. Go ahead with your question.
Thank you for letting me speak. My name is Jan Thompson, and in transparency, I am on the board of NEQOLS, and I have been for 5 years. I am a West Webster resident, And I think I spoke not too long ago, between my children and grandchildren, we own 21 residences in Webster. So I certainly understand the tax district issue. One of the things that I really wanted to address, and there may not be an answer, perhaps Mr. Adams can answer this. I listened to Bob Lonsberry this morning, and our Supervisor Flaherty gave an interview with Bob, and he made 2 points. The first I will address, and Karen Mustafa did. On several of the meetings and in the slides, it was stated by Mr. Flaherty that Nichols wanted and requested $800,000. We don't know where that number came from. We sat on the board and we prepared that number with the exception of the time that Mr. Flaherty and Ahmed began the negotiations. This morning on Bob's Lonsberry, he clearly stated that we asked for between $400,000 and $450,000 annually. So that's the first question I would like to have clarified. What is the actual number that the town is looking at or is being shared by the emails from the town supervisor? The second that I'd like to ask is Mr. Flaherty also stated that he had not received any financial data or financial information from Nichols for 17 months. Mr. Adams, perhaps you can address that. Is that true?
Okay, thank you, Janet. Paul, you want to go with what you got financial data for and whatnot?
Sure. I think I can say that, as I stated earlier, that it looks like the organization is going through about $20,000 a month. So we originally thought that the short-term solution would be about $20,000 a month. Take a step back and try to come up with a long-term solution. So I don't know if I answered all of her points.
John, do you want to address where the 800,000 came from versus the 4 in presentations?
Ahmed's presentation back in July, was it 25th? One of the slides did address the $800,000. I think that was utilizing 25 cents per thousand would generate $800,000. It was used as an example. And to your question with respect to the 17 months, I could be wrong, but I listened to the interview after the interview was over, and you know, the supervisor can clarify this later. I think he may have been referring to the audited financials he hasn't seen in 17 months, but clearly Nichols has been going through a great deal of financial disclosure to the town of Webster since September, and you know, they call it a deep dive. This is the deepest dive I've ever seen into any type of business whatsoever. It's taken a long time because more questions are generated as more information is provided to the town. So that's the 17 months I believe that the supervisor was referring to, was the audited financial, but I can clearly understand why it may have been misinterpreted by a lot of the people that were listening to the interview today. So I'm just trying to add clarity to that.
Thanks, John. Is there anybody else in the audience that would like to? Ken, you want another question? You get just one. No, please make it short because we only got 7 minutes left.
It's going to be a 4-part question.
One question, 5 parts. No. One quick question, Ken.
Well, I have one statement. Charlie, you asked about the history of the ambulance and NEQ. I put together a 2-page history that I published on Facebook. I'll give you this when I walk by, starting in 1985. And you guys can review it if you want to. I think it's pretty accurate. I pulled most of it from your website. Because I got a lot of people asking questions, so I answered it. Now, my other question is, it was stated that of the 17 agencies, a majority put BLS in an ambulance?
ALS in an ambulance.
Or ALS in an ambulance? Does that mean that Webster residents are paying more for an ambulance trip to the hospital if it includes ALS and BLS?
So I think if I understand your question correctly, so there's an ALS call that a fly car responds to a residence, right? And it's determined that that patient needs to get transported to the hospital. So they're going to get a bill for ALS, and they're going to get a bill for BLS.
No. So what happens is the BLS ambulance bills at an ALS rate, and then the delta is paid to NEQ.
Okay. Does that answer your question?
I didn't hear that. Can you say that again?
Can you pull your mic in front of you a little bit, please?
Yeah, so what happens is, when the paramedic gets on the ambulance, if it's an ALS level call, then the BLS ambulance bills at an ALS rate, and they pay the difference from the BLS to ALS rate to the NEQ.
So
they
basic,
need two separate bills, one for ALS and one for BLS.
negative, correct?
Go ahead, Russ.
Right? No, I'm asking you, the patient only gets
That's
one
my
bill.
understanding.
Yes, the
That's
patient.
we don't do the billing, Ken, but my understanding is the patient gets one bill.
Yeah, and that's standard ambulance billing, which I'm very involved with mine. The patient's gonna get one bill. Whether there's, how it gets broken down and reimbursed on the back end, we're not allowed to, we can't do that in EMS.
All right.
Okay, thanks, Ken. Well, there's a young man in the back that's had his hand up. Come on up to the microphone if you have a question. I'm pointing to you. Yep. Yes, sir.
You're being nice and you're confusing people. You're being nice and confusing people.
Being nice.
I'm Robert Schroeder, and I was a patient, and thankfully EMS came through perfect within a couple minutes. My thought is, from a fire company way back, if you didn't pay the fire company and they came to your house, and they didn't fight the fire if you didn't pay them. Is that what we want for ambulance service? If you can't pay them, they don't pull you. We're looking at taxes like insurance. We're spreading it across the town so that all of us pay less totally. It's the same with floods and whatever. I don't think the expense individually is expensive when you think of it from an insurance standpoint, unless you want to buy your own insurance, which is another option. Thank you.
Thank you.
Thank you.
Thank you. Jerry?
I just wanted to quickly say this was great to see everybody come here tonight, because this is not happening in the world today, that this community could get together. It was calm, it was polite, we followed the instructions, and so go Webster, nice job.
Thanks, Jerry. Well, apparently Jerry took my closer, so I just want to make the comment that it is now the bewitching hour of 8:57, and so we've had everybody, as best as we're able to, listen to their questions and get their answers. And I do appreciate the fact that everybody was polite and attentive, and that I want to thank our panelists for coming out. I appreciate you taking time out of your evenings. Those of you that are in service, thank you very much. It's greatly appreciated. And I think with that, we're going to close, and everybody have a good evening and drive safely. Thank you.
Thank you very much.